This video is going to answer the question of how long should low back pain last. My name is Dr. Nick from Preferred Physical Therapy, where we help people 40 plus stay active and independent, live free from painkillers, and avoid surgery. Are you wondering how long your low back pain is going to last? This video is going to answer all your questions. Keep watching. So many of my patients come in with low back pain wondering how long their symptoms are going to last. And the answer is not always easy. It definitely depends on a wide range of issues. So I'm going to go over a couple of those things to help you narrow down where you think is most appropriate for your case. Every year, over 80 million people suffer from low back pain. The good news is it's going to go away within 2 to 3 weeks and won't require any kind of medical attention. A lot of folks have recurrent low back pain, or we call episodic low back pain, where every couple of years they do something to their back, something simple, and then they have severe pain for 2 to 3 days. They sometimes have to call out of work, and then it kind of lingers in this ache for 6 to 8 weeks. Now that's typical for a lot of folks in their 30s, 40s, and sometimes early 50s. If you fall into that category, just recognize the fact that you're going to be in a lot of pain for the first few days, and then it should be getting better. If you're noticing that those episodes of low back pain are occurring more frequently, or the ache and pain is lingering longer, it's time to take action and get that treated. In better understanding how long your low back pain is going to last, it's important to understand what is classified as acute low back pain versus what's classified as chronic low back pain. And acute low back pain is a sudden onset where 1 minute you have no low back pain and then something happens and now you have low back pain. It can even happen if you wake up one morning and you have a little backache that progressively gets worse. That's still called acute low back pain. And it's acute for up to 12 weeks. So everything before 3 months is considered acute. For whatever reason in the medical community, after that 12th week or that 3rd month, we now start calling it chronic low back pain because it hasn't shown any change or variation from the pain. So from 12 weeks on, from 12 weeks to years, it's now considered chronic low back pain. But that's not all bad news, because so many folks come into our clinic being labeled as chronic low back pain sufferers are finding a lot of things they can do to get relief, whether that's immediate relief, and then even begin to chip away at some of that discomfort to go back down to no low back pain or very, very low level low back pain, so they can still do all the things that they like to do: pickleball, running, weightlifting, sit for long periods of time at work, garden, shovel, bend, lift, twist, all the things that historically cause low back pain. If you're having chronic low back pain, this low-grade ache that's been going on for a long time, without some kind of intervention, it really won't have a chance to go away and often gets worse because you go to the doctor and they prescribe pain pills and rest. And a lot of times you've already been doing that at home. You've already been taking over-the-counter NSAIDs or Tylenol, aspirin, or you've been taking it easy, modifying your activities, because the more that you do, the more you recognize your pain goes up. So my recommendation, if you've been having low back pain anywhere from 2 to 3 months to years, it's time to have a specialist look at it and see what can you do next in order to get your pain to come down and get under control without using injections, surgeries, or narcotic pain pills. If you've been to a healthcare professional and been diagnosed with things like herniated disc or bulging disc or degenerative disc disease, spinal stenosis, things that have labels, degenerative joint disease, a lot of times these are diagnosed because you've had imaging reports that classify you as having one of these conditions. The reality is these are very, very common. A study came out that randomly took MRI images from 100 people and found that 40 of them, without low back pain, 40 of them had herniated discs, had degenerative disc disease, degenerative joint disease, facet joint arthropathy, that had all of these labels but still didn't have low back pain. So just because you have one of these conditions or have been told you have one of these conditions doesn't mean that you've been given a chronic low back pain death sentence. It doesn't mean that you're going to be constantly having low back pain. There's lots that you can do to manage this and not feel like you're confined to this label or diagnosis. So to answer how long will your low back pain last, it depends. Is it acute, up to 12 weeks? Is it chronic, already lasting longer than 12 weeks? How long have you had it on and off? Is it happening more frequently? Being obese or overweight, inactive versus active, a lot of little factors will play a part into how long your low back pain is going to last. Just know that you're not branded to suffer eternally with low back pain. There's lots that you can do to get relief, and we're here to help. If you found this video helpful, we have a lot of other videos that will go over specifics on how to diagnose what kind of low back pain you have and what kind of exercises are going to be best for you, what positions to sleep in when you have low back pain episodes. We have a course, we have a low back pain online course that's designed to help you identify where you are in your journey of low back pain and what exercises are best designed for you. Take a look at that in the link below. If you found any of this helpful, go ahead and like the video and leave a comment below and let us know what was most helpful for you. Let us know what the doctors have told you and where you are in your journey, and ultimately what's given you the most relief. I have a script, but I'm like, every time I start talking, I deviate all over the place from the script.